one term or thesis or central point of trance and treatment that I was curious about is the principle of restructuring. And I just wanted to know theoretically what the principle of restructuring is and why it's so important to how you think of hypnotherapy.
Because the idea is that, and this is related to something that came along later, which is cognitive behavioral therapy, that you see an old problem from a new point of view. That
I see.
That's it. So what I was presenting you was, in some ways, may have been a little surprising to you. That one, I'm saying, actually enjoy eating more, not less. Don't fight it. Don't. And the other thing is reconstitute your relationship to your body. You are your body's keeper. You're a parent to your own body. So act that way. Act like a loving parent rather than an abusive landlord. Take good. So it's taking the same situation and asking you to see it from a new point of view. And that's the idea of the restructuring. Hypnosis is a matrix within which you can be more open to adopting a new point of view. But the restructuring is the new point of view. One of the things that people who use hypnosis always say to their patients, and I said it to my patient yesterday, the worst thing you can say to somebody is, don't think about purple elephants. What are you going to think about? So you focus on what you're for. You want to come to a resolution of the problem that makes you feel good, that gives you intermittent positive reinforcement, not negative. I'm not depriving myself. I'm taking better care of my body. I can enjoy what I do eat more than I did before. So you focus on what you're for.
And this clearly relates to the notion of cognitive flexibility. And now that we've laid out what this principle of restructuring is, I can see how it relates to all of the instances of hypnosis that you've already described today, how it's operating in the background.
Yes, that's exactly right. That it's a matrix within which these things can be more effective.
But a question that this now raises for me is whether hypnosis has applications for more severe psychopathies, like schizophrenia, for example, where maybe the patient's cognitive flexibility isn't the underlying factor that needs to be targeted for treatment.
Well, you put it well, but it's worse than that. That it's cognitive inflexibility. Schizophrenia comes from the notion of a split between thought and affect. And people who suffer from schizophrenia often have very rigid views. They have fixed delusions that don't make any sense, but try and argue one of them out of the delusion. They'll just say, oh, you're part of the system that's doing this to me. So in general, unfortunately, people with schizophrenia, and we've studied this, they're half as hypnotizable as normal people as a group. They're really not hypnotizable.
Fascinating. Huh. Well, the last question I have about hypnosis in general before we move on to Reveri is, we've been talking a lot about how it treats certain disorders. So eating disorders, for example, or post-traumatic stress disorder. But I wonder if it is also the sort of tool that can lead someone to very deep insights about themselves in the sense that a lot of talk therapy or psychoanalysis is geared toward, or if you're using it primarily as a tool for treating disorders.
Well, I use it primarily for symptom control, but yes, there are people who can come to some sort of profound new understandings of themselves. As one extreme example, I treat people with dissociative identity disorder, what used to be called multiple personality disorder. And you can use hypnosis to get them in touch, to improve the communication among different elements of themselves in such a way that they see that they're not really different people. They're just have difficult connections between one part of themselves and another. You're different when you're out having a good time at a party than you are right now, hopefully. But you experience the continuity of connection and the reasons for the shift, and they don't. So it can be sometimes very helpful in building bridges. One of my dissociative identity disorder patients said that I used crazy glue to try and glue the parts of together. It can also help you restructure your understanding of yourself or what you do or why you do it, that people can see things in themselves that they may not have been able to admit or see before, like my patient who was raped at age 12, that you can become aware of aspects of yourself that you previously had, rejected or ignored or denied. And so, yes, it can be helpful.
I'm guessing that it's quite similar in some ways to the MDMA you mentioned earlier with PTSD, in that in increasing openness, it facilitates your ability to bring in things that you have repressed, or I think you just said, things you wanted to ignore. And so it grants you more access to the material that needs to be changed or viewed differently for growth.
Yes, that's well put. It's more sort of like non-judgmental awareness. You think through what they mean later, but you can just allow yourself to experience it, see what it means later. So that can be a very useful capacity.